Hey Carly, how you doing today?
I'm good. How are you?
I'm doing well, thanks for asking. What's been going on this last week?
Um, I've just been feeling like kind of in a rut. I mean, I've been looking for a job and haven't really gotten anywhere. And then the, um, I had a drink the other night,
Mm-hmm.
and I just felt like that, like me not having a job and then me going out and having that drink, like it wasn't deserved, and I just felt like such a loser because that was the time that I should have been at work
Mm-hmm.
if I had a job, and instead I was at the bar drinking. So I had one drink, and then it led to another, because then I just felt worse, and I figured I had one, so
Alright, so how much did you drink in total?
I think I lost track after 4 or 5.
Alright, how long had it been since you had a drink before that?
I did really well. It was, I think, like 3 weeks.
3 weeks?
3 weeks or so.
Alright, so you did really well. And then you had one drink, and that just made you feel like you weren't successful.
I felt like a loser.
Felt like a loser. And you feel that kind of led to drinking some more.
Mm-hmm.
So you had a rough time with things.
Yeah.
Yeah. And how about now?
I mean, now I just kind of, I don't know, I'm afraid to go back. Like, I'm afraid to go out with, like, some friends. They invite me out to dinner,
Mm-hmm.
but I know there's alcohol, and
Is that where you were when you had that first drink? Was that with friends?
yeah.
Yeah. All right. So there's a few things going on. We've talked in the past, right, about separating the behavior from the person, right? So behavior is what we do, not who we are.
Mm-hmm.
You remember those discussions? And correct me if I'm wrong, but it sounds like I'm going to use some different words than you used, but it sounds like when you had that first drink, you're kind of ashamed that you had a drink and you had it during the time when you would have been working.
Yeah, that's pretty accurate.
That's pretty accurate. All right. So taking yourself kind of back to that moment, right, where you had that first drink, like you finished that first drink. What was your thought at that moment?
Just, like, shameful. Like, I did really, really well, and then here
Okay.
I was, and I just finished a drink, and I knew I wanted another one.
Okay. So shameful is kind of like the feeling, but the thought is I did really, really well. Right?
Mm-hmm.
So that's what you were thinking, was I did really, really well. And what was that the end of the thought, or was there more before you had that next drink?
I guess just I was doing well, and then I had the drink, and I just felt like an awful person. So figured what was the hurt in having more.
Alright, so the sequence would have been you had the drink, you felt shameful, at the same time you're thinking that you were doing really well, and then just really, as you said before, you just felt like a loser, and then you decided might as well just have the second drink.
Mm-hmm.
So another thought might be that, like I might as well just have the second drink.
Yeah.
Yeah. So you can see how there's some thoughts and some feelings at work right as you finished that first drink. Was it fairly quick? Were those thoughts and feelings fairly occur fairly quickly after the drink?
Yeah, I would say as I was finishing and then finished.
So right away you regretted it.
Mm-hmm.
And in that regret, as you thought about it, thought might as well just continue drinking now because you kind of blew it at that
Yeah,
point.
I already messed up. I might as well keep going.
Okay. And that's a common cycle to fall into. And you had 3 weeks where you hadn't had a drink prior to that. Right. So let's look at this. Let's try to separate the behavior from the self a little bit. If you had a friend who was in the same predicament, right, who had a history of using alcohol and then had 3 weeks without any alcohol use, and then their behavior was to have a drink, what would you think of them?
I would think that they had a rough day or something must have happened where, it's just one drink.
Okay. They had a rough day with one drink. And what would you think of their behavior? How would you categorize that behavior?
I guess just they made a mistake.
Mm-hmm. So, not ideal.
Mm-hmm.
Depending on their point of view, maybe a little irresponsible.
Yeah,
Mm-hmm.
I think irresponsible would be...
Irresponsible?
Mm-hmm.
All right. But you wouldn't necessarily characterize them as a bad person.
No.
But their behavior was a bit irresponsible.
Yeah.
In terms of like the recovery plan, which would be to not drink. All right. But when you apply that same examination to your own situation, how do you characterize yourself after you had that first drink?
It was my mistake. It makes me a worse person for doing it.
So you see how you're being a little, it'd be quite a bit rougher on yourself. Like your evaluation of yourself is fairly harsh. Right? You mentioned loser earlier and ashamed, whereas you wouldn't necessarily evaluate somebody else that way. How would you evaluate your behavior? How would you judge your behavior of taking that first drink?
Shameful. Irresponsible.
Mm-hmm.
Just bad overall.
So bad, irresponsible, shameful. Is there a way to separate that behavior in terms of your thinking, in terms of the way you evaluate it from yourself? Like, are you and the behavior together, enmeshed, or can you be separated?
I would think we could be separated,
Mm-hmm.
but it feels like I am that behavior.
In that moment,
Mm-hmm.
it's very congruent for you.
Yes.
Right? The shame matches the behavior matches shame. Like they're one at that moment.
Mm-hmm.
But really, logically, rationally, you're you, right? You have an identity and values, and your behavior is something you do. But in the moment, it's hard for you to see that.
Mm-hmm.
Looking back on it now, are you able to see the distinction between what people do and what they are?
Yeah. Just because you have one drink doesn't make you a horrible person, I would think, right?
No, certainly not. No. And you were clean for 3 weeks, and you had one drink. So really, your behavior was a slip. Right? It was,
Mm-hmm.
and irresponsible in relationship to your goals, I suppose, but still a slip. And you could have stopped. But that shame got a hold of you, right? That thought, well, now I've done it.
I blew it.
Yeah, so with that mentality, you kind of set yourself up for drinking more. So I think this is important because we've seen this cycle, like where you have weeks of sobriety, and then you'll drink a bit, and then have weeks of sobriety. And I'm wondering if part of the difficulty you're facing is you're not coping with the slips as just slips.
Okay.
You're allowing them to be gateways into a lot more drinking than a slip. Does that make sense?
That sounds pretty accurate.
And you see how the shameful feelings kind of just interfere with the behavior that's really consistent with your goals, which would be to not continue drinking.
Mm-hmm.
Another piece of this too is the associating with friends who drink. You're putting yourself in a treacherous situation. And again, that's a behavior, right? That doesn't make you one way or the other.
Mm-hmm.
It's a behavior. How would you judge that behavior, going out with friends?
I don't know. I mean, it's difficult because I like being around those people.
Mm-hmm.
But I guess it's risky.
Risky, okay. It's a risky behavior. And what does it make you? Who are you? Because you do that behavior. Like, how do you feel about yourself when you take that risky behavior?
Guilty.
Okay.
Yeah.
So you have guilt when you go out with your friends, and then you have shame if you drink.
Mm-hmm.
Right? And both, in this case, both emotions that kind of point you in the direction of more drinking. So part of this behavioral strategy here is to avoid those circumstances, like to recognize that that's a risky behavior, which you have. And the other part would be to deal more effectively if you do slip.
Okay.
Right. Does that separation of what we do and who we are make sense to you rationally?
Kind of.
Feels a little unnatural though.
Yeah.
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 So maybe as you're confronting similar situations in the course of the next week, you could be aware of behaviors that might put you at risk and try to separate your identity from that behavior. So just judge the behavior.
Okay.
Right? And don't pass any judgment on yourself. Does that make sense?
Kind of, yeah.
It might help you to, since it's a little tough to, because right now the feeling and the judgment are intertwined, right? It might help to write it down when these things happen, and kind of write down like one row for, this is how I judge this behavior that I'm thinking about doing, and this is how I judge myself. So if you see a lot of self-judgment, that might be a clue that you're falling into that cycle a little bit,
Okay.
where you're making decisions based on that emotion instead of a rational judgment of the behavior.
Okay.
Would that help a little bit?
Yeah, I think that would probably be beneficial.
All right. So that'll be our plan going forward until next week is note, document your judgment about your behavior
Okay.
and any judgment you may have about yourself. All right. And there's some insight that can be gained there. Right? You kind of distinguish the two. And make a note of those and try to use that evidence before making a decision that might put you in a risky spot.
Okay.
Does it sound like a plan?
Yeah, I think I can try that.
Okay, good. I'll see you next week and we'll see how you did with those goals.
Okay.